During a press conference earlier today in Kotu, health authorities and partners have raised serious concerns about the growing threat of antimicrobial resistance known as AMR, as the national awareness campaign begins this week. The event brought together key stakeholders from the health sector, livestock services, laboratories, and international partners to reinforce the urgent need to coordinate action. Chairing the event, Bintu Cham from the Directorate of Health Promotion emphasized that raising public awareness is key to prevent the rapid spread of AMR. Delivering the welcoming statement, Jundu Jata, the AMR focal person, reiterated the importance of community involvement, noting that AMR can only be addressed through informed participation and responsible practices.
Over the years, antimicrobial resistance has been seen as a threat that is coming, but that is normal because the threat is already here. People are dying in millions annually due to antimicrobial resistance. To ensure that we remind ourselves and remind the public that there is a threat that is currently happening and people need to be aware and take necessary steps to ensure that we reduce this spread of antimicrobial resistance.
Representing the World Health Organization (WHO), Mamadou Baro described AMR as one of the most urgent public health threats. He warned that if no action is taken according to research, AMR could cause 10 million deaths by 2050.
Globally, AMR is already responsible for at least 1.27 million deaths annually and associated with nearly 5 million deaths every year. If no action is taken, projections showed AMR could cause 10 million deaths annually by 2050.
He highlighted that the misuse and overuse of antibiotics in humans, animals, and plants remain the major drivers of resistance. According to him, prevention, protection, coordination, and control are essential pillars in tackling this growing menace. Speaking on laboratory efforts, Mr. Haruna Jallo stressed the importance of AMR surveillance and monitoring. He noted that collecting and sharing data across all sectors helps slow down the emergence of resistance and provide a clearer understanding needed to design effective policies. He added that surveillance supports better AMR interventions in both hospital and environmental settings.
Antimicrobial resistance surveillance and monitoring detects and tracks changes and trends in microbial population, including drug-resistant microorganisms and resistant determinants such as genes and resistant mechanisms. Integrate findings on drug-resistant microorganisms in animals, humans, plants, and the environment. This involves sharing data and information across sectors for more effective and coordinated response to tackling AMR.
Baba Fofana, a clinical staff member, said AMR remains a leading cause of death globally. In 2019 alone, a significant number of deaths were linked to bacterial infections.
It is a leading cause of death around the world, with, according to the most comprehensive global estimate, to death, 4.95 million people die as a result of bacterial resistance. And this report was in 2019. The emergence of AMR and rising numbers of infections that are caused by antimicrobial resistant bacteria represent a global threat to public health, and not just the public health, but also to agriculture.
He emphasized the need to understand the determinants of bacterial resistance, warning that pollution, including contaminated sewage and pharmaceutical waste, could further worsen the situation. Taking the livestock perspective, Dr. Usman Sise from the Department of Livestock Services underscored the crucial role of animal health in the fight against AMR.
The phenomenon of AMR is very real. It's a Gambian problem, and then it threatens the very, very core of our existence, and therefore our resilience, and then our food and national security. When we're talking about animal, is also under question.
He urged animal owners to be cautious about how and which antibiotics they administer to their animals, noting that improper use contributes significantly to the spread of resistance. Rohingyai, Deputy Director of Health Promotion and Education, said the awareness campaign aims to better enlighten the public on AMR and social and behavior change communication (SBCC).
Who are misusing this is the public, policymakers, and also, broader stakeholders where we all belong to one way or the other, isn't it? So SBCC will also promote best practices, and the key message, as highlighted by the previous speakers, we must not use antibiotics except being prescribed by who? A medical professional. At least please, we put across this message as much as we can, because if you look at our community, that is what is happening. Everybody has become a prescriber or giver of antibiotic.
This year's theme, We Must Act Now, reflects the urgency and collective responsibility required to protect public health. Binta Estiao, Bessel Media.